The magnitude of the Ebola virus outbreak may be vastly underestimated, the World Health Organization said on Thursday. It is preparing for the crisis to continue for months. More than 1,000 people have died and nearly 2,000 sickened by the virus. And while this is already the deadliest ever outbreak, WHO says the evidence suggests that it will get worse. There is no licensed treatment for Ebola. The World Health Organization opened the door for experimental Ebola drugs this week, after a panel of ethicists condoned such treatments in hopes to control the outbreak. Nigeria's Ebola victims will receive an experimental untested drug called nanosilver. Health officials said the drug came from a Nigerian scientist whose name was not disclosed. Little is known about nanosilver, but Nigerian officials are hopeful. The drug was sent to treat 8 Nigerians who tested positive for Ebola. Liberia has 3 doses of ZMapp, an experimental drug produced by MAP Biopharmaceutical in the U.S. The experimental drug has been administered to 2 Americans who contracted Ebola in West Africa. These are the last known doses of ZMapp, and it will take months to build up a modest supply. Given the scarce global supply of the experimental drugs, the decision of what treatments to give to which patients has proved controversial.